Very good afternoon, everyone. And the first question which I will be discussing is basically it's Spalding classification. So yeah, the question is basically it's I think microbiology question, and it's like which of the following is false regarding the Spalding classification. So yeah, the question is which of the following is false regarding the Spalding classification. So yeah, if you know the Spalding classification, then only you can answer. Spalding classification is basically for disinfection. So basically you divide in Spalding classification there are three types. That is, we have critical, semi-critical and critical devices. So basically we divide that. So yeah, the question is which of the following is false regarding the Spalding classification, and the options here are semi-critical items require a high level of disinfection. It's a non-critical items which do not require disinfection. It's a cardiac catheters which are classified as critical items. It's a so much noise is there. Okay, it's a critical items which are associated with a high risk of infection. So yeah, basically they are asking in which category it will be there. So see, here they have done cardiac catheters are classified as critical items. See, whenever any device is there, when there is any device, it's in the sterile area of the body. So what is the sterile area of the body? That is the blood. So yeah, if it is a cardiac catheter, we are going to the blood. So it's a critical item. And then we have a semi-critical item, and semi-critical is basically like you have its endoscopes. That is the mucosa, we are going through that. So that's the mucosa that place. And we have a non-critical devices like stethoscope, like stethoscope, furniture and all that. Basically it's to the skin and not to the mucosa or the blood. So yeah, the options were semi-critical items require high level disinfection. It's a non-cardiac items which do not require disinfection. It's a cardiac catheters which are classified as critical items, or it's a critical items associated with high risk of infection. So yeah, the false in this case is a B, that is a non-critical items which do not require disinfection. Yeah, sorry for 2 minutes it will be sound like that. So yeah, it's the non-critical items which do not require disinfection, because like stethoscope and all, but it requires disinfection. Like we have the intermediate and low level disinfection is required here also. So next we move on. 25-year-old man falls from a multi-storied building onto his feet and commits suicide. So I repeat, it's a 25-year-old man who falls from a multi-storied building onto his feet and commits suicide. So which of the following structure is most likely to be seen? Options are ring fracture, hinge fracture, spider web fracture, or it's a pond fracture. Anyone wants to answer this? It's an easy one. It's basically a 25-year-old man. I'll just repeat, it's a 25-year-old man who falls from a multi-storied building onto his feet and commits suicide. So which of the following fracture is most likely to be seen? It's the ring fracture, hinge fracture, spider web fracture, or it's a pond fracture. So yeah, if you want to answer this, it's an easy one. Basically, which fracture will be? So yeah, the answer is, okay, I will not tell. The answer is basically it's A, that is the ring fracture. So whenever there is a fall, that is you commit suicide. So ring fracture is very common. Why? See, basically when you fall, your body will fall on the ground only. And yeah, it's not spider web. Spider web is basically it's a committed fracture. No, it's not spider web. It's a ring fracture. So yeah, whenever you fall, it's like your body all your body will be on the leg first, then it will go through the spine and hands. So whenever it goes to the spine, the cervical spine will go inside. It's like that only. The mechanism is the skull bone, it will be ring fracture. From the cervical spine it will go up. That's why it's a ring fracture. And the spider web fracture, what you were telling, it's a commuted fracture. And yeah, but where there is no displacement of fracture. So yeah, next we had the hinge fracture. Hinge fracture basically divide the skull into two parts. It's a linear fracture. We had spider web, which I told already, and we have a pond fracture. Pond is basically pond fracture is, I don't know. Okay, pond fracture is basically it's seen in children where there is a very elasticity is there. So whenever there is a elasticity of the bones, pond fracture can be seen. It's also known as indented fracture. Next we move on. It's an all MPS are inherited in an autosomal recessive manner except, I repeat, all MPS are inherited in an autosomal recessive manner except options are Hurler disease, Hunter's disease, Maloteu's Lamy disease, so it's a Sanfilippo A disease. I think yesterday we discussed like Hunter's and Hurler's disease. So I'll just repeat once. All MPS are inherited in an autosomal recessive manner except it's an Hurler's disease, Hunter's disease, Maloteu's Lamy disease, so it's a Sanfilippo A disease. So I know it's what is the right answer. If you know, it's an easy one. Well, yesterday only we discussed the difference between Hurlers and Hunters. So we had a case yesterday and we discussed Hunters and Hurlers disease, and the main difference between Hunters and Hurlers is like Hunter is a S-linked. Yeah, it's a Hunters is a S-linked disorder, whereas we have the Hurlers disease, which is an autosomal recessive. So here the question is that only, which is it is an autosomal recessive disease except. So yeah, the option is Hunter disease is the right answer here. So yeah, Hunter disease I will just tell it's an enzyme deficient in iduronate sulfatase. It affects more common male, and yeah, there is no Claudine seen. There is no corneal Claudine seen in case of Hunters, and we discussed in Hurler disease there was a corneal Claudine. So yeah, clinical features in that way we discussed yesterday, and yeah, there were extensive Mongolian spots, group skin papules are seen, and all that is there. So next we move on. It's a multiparous woman at 34 weeks of gestation, presented with bleeding per vagina, and was diagnosed to have a grade 2 abruptio placenta. So which of the following features may be seen in her? I repeat, it's a multiparous woman at 34 weeks of gestation, presented with bleeding per vagina, was diagnosed to have a grade 2 abruptio placenta. Which of the following features may be seen in this condition? It's a hypovolemic shock, anuria, coagulation defect, or it's a fetal distress. So yeah, if you want to tell, it's a multiparous woman, 34 weeks of gestation, presented with bleeding per vagina, diagnosed to have a grade 2 abruptio placenta. So which of the following features may be seen in this condition? So yeah, the options are hypovolemic shock, anuria, coagulation defect, or it's a fetal distress. So yeah, if you can just answer this, if you know the answer, better only. So yeah, it's basically grade 2 abruptio placenta which we are discussing. So it is associated with what? Hypovolemic shock, anuria, coagulation defect, or it's a fetal distress. So yeah, if you want to tell, okay, I will just tell that the answer is it's a D. Grade 2 abruptio placenta is associated with fetal distress. And what are the other findings? See, anuria, hypovolemic shock, and all that will be in grade 3, not in grade 2. We are discussing grade 2 here. And yeah, coagulation defect will be also seen in grade 3 only. In grade 3, what we have, it's fetal distress, pulse rate increase, BP maintained, and uterine tenderness will be present. So yeah, next we move on to the next question. We have ansa nephroni is lined by. So it's an anatomical question, but if you know, ansa nephroni is lined by squamous and columnar epithelium, cuboidal and columnar epithelium, squamous and cuboidal, or it's a squamous epithelium only. I repeat, ansa nephroni is lined by what? It's a squamous and columnar, cuboidal columnar, cuboidal and columnar, squamous and cuboidal, or it's a squamous epithelium only. So yeah. Okay, I also didn't know this. It's a very easy, but yeah. See, ansa nephroni is also other name of loop of Henle. So now you can just tell if it's a case of loop of Henle, what it is lined by. So I will just tell the answer also. The answer is really C, that is the squamous and cuboidal epithelium. So that is lined by both. It is squamous also, cuboidal epithelium also, in case of loop of Henle. So yeah. Let's move on. It's a patient undergoing treatment for colon cancer, develops hypertension. So which of the following drugs is the most commonly implicated? It's also a quite common question. I'll just repeat, a patient is there who is undergoing treatment for colon cancer, develops hypertension. So which of the following drugs is most commonly implicated in this condition? And the options are trastuzumab, bevacizumab, panitumumab, or it's a cetuximab. So yeah, I just repeat last time, it's a patient who is undergoing a treatment for colon cancer, develops hypertension. So which is the most commonly drug implicated here? It's a trastuzumab, bevacizumab, it's a panitumumab, or it's a cetuximab. So yeah, if we can tell the answer, it's basically angiogenesis inhibitor. It's one of the characteristic side effects of a angiogenesis inhibitor. So the right answer is it's B, that is the bevacizumab is the right answer, and it will cause hypertension in patients who are undergoing colon cancer treatment with bevacizumab. So yeah, so it's the mechanism and side effect. So next we move on. It's next question we have, what is the radiological procedure of choice in a patient suspected to have a solitary rectal ulcer? I repeat, what is the radiological procedure of a choice in patients suspected to have a solitary rectal ulcer? Options are MRI, defecography, endorectal USG, or a CT scan. It's an easy one, just guess it out if you don't know. Radiological procedure, that is investigation of choice in case of a solitary rectal ulcer. CT scan, MRI, dephocography, or it's endorectal USG. So yeah, okay. The answer is that is the dephocography is the right answer. It is a radiological procedure of choice for diagnostic evaluation of a solitary rectal ulcer syndrome. That is the SRUS. So there will be a full thickness rectal prolapse, internal prolapse, paradoxical puborectalis syndrome. It's a thickened rectal fold. So yeah. So how will you do a dephocography? It's basically real time the morphology of the rectum and anal canal in a physiological setting by injection of a thick barium paste into the rectum and the subsequent evacuation. So yeah, so we do a diagnostic evaluation for a case of a solitary rectal ulcer by dephocography. Next we move on. A 30-year-old patient is there. I will just repeat. It's a 30-year-old woman with iron deficiency anemia is prescribed oral iron supplements. So foods containing which of the following can she take to increase its absorption? Phosphate, oxalate, carbonate, or it's ascorbate. So yeah, I just repeat. It's a 30-year-old woman with iron deficiency anemia is prescribed oral iron antibiotics, oral iron supplements. So food containing which of the following can she take to increase its absorption? Phosphate, oxalate, carbonate, or it's an ascorbate. So yeah, it's an easy question. So it is absorption of iron is increased by ascorbic acid. So yeah, so in case of ascorbic acid we see that. So I'll just repeat. The question was basically it's a 30-year-old woman with iron deficiency anemia is prescribed oral iron supplements. So food containing which of the following can she take to increase its absorption? And yeah, then I told the options here, and the right answer was ascorbic acid. So you have to remember, like, it's an ascorbic acid in case of iron deficiency anemia. Ascorbic acid, citric acid, amino acid, and the sugars in the diet. And the inhibitors are tannins, carbonate, oxalate, phosphate. Next we move on. It's a 2-month-old infant presented with runny nose and bullous lesion on the skin and legs. Her X-ray is given below shows features of peritonitis. So which of the following is the initial investigation of choice? I will just tell you. Yeah, but okay, you have sent a request, but what will you do after that? So yeah, the question was very simple. It's a 2-month-old infant presented with a runny nose and bullous lesion on the skin and legs. So her X-ray is shown below. I'll just tell what is the X-ray. X-ray basically it's a case of it's a periostitis. So yeah, it's a periostitis. I'll just repeat once. It's a 2-month-old infant presented with a runny nose and bullous lesions and up to on the skin and legs. It's a case of a periostitis. So X-ray is given below, that is suggestive of periostitis. So which of the following is the initial investigation of choice in case of a periostitis? So yeah, the options are VDRL, that is the Venereal Disease Research Laboratory, Treponema pallidum hem agglutination assay, and we have a fluorescent treponema antibody absorbent test, so it's a culture. So yeah, if you want to answer this, okay, you don't want to answer this. Basically, it's a case of a periostitis is a hallmark of a skeletal manifestation, and that too, okay, it's a congenital syphilis. So yeah, if anyone wants to tell in congenital syphilis, we have discussed what is the investigation of choice, and yeah, it's VDRL only. So yeah, runny nose, bullous lesion on the skin and legs, and it's a case of a congenital syphilis. Next we have, it's a primary gravida who presents to the labor room at 39 weeks of gestation. On examination, you notice the fetal head was appeared at the vulva. So which of the following maneuver can be used to assist the delivery of the head? So it's a very simple question. It's a primary gravida who presents to the labor room at 39 weeks of gestation. On examination, you notice that the fetal head has appeared at the vulva. So which of the following maneuver can be used to assist the delivery of this head? It's a Prague maneuver, Lofset's maneuver, Pinard, or it's a Ritjan's maneuver. So yeah, it's an easy question, but if you know the answer, then only it's an easy. But yeah, anyone wants to, which is the, because the patient is in normal labor only, so which is the maneuver you use in a normal labor for that to deliver, assisting the delivery of the head? So yeah, the options are Prague's maneuver, Lofset's, Pinard, or it's a Ritjan's maneuver. So yeah, if you know. Okay, now I will just tell the answer here. The answer here is D, that is a Ritjan's maneuver. Basically, what we do in a normal labor, whenever you have the problem like the head of the baby is not getting delivered, so you use this maneuver. So yeah, the maneuver is done it's allow the controlled delivery of the head, and it's basically done when the head distance the vulva and perineum enough to open the vaginal introitus. Diameter should be greater than 5 cm, and the towel is basically you have to imagine things what I told. But yeah, if I will just read it, if you can just imagine and things like that. A towel is waved and the gloved hand may be used to exert forward pressure on the chin of the fetus to the perineum. The other hand exerts pressure superiorly against the occiput. So yeah, it's difficult to imagine, but if you have the photo, you will very easily. But yeah, just remember it's a Egyptian's maneuver which we use for the normal head. So yeah, next we have which of the following is a criteria included in the guidelines for drinking water quality recommended by WHO. Yeah, it's also easy one if you know. See, which of the following is a criteria included in the guidelines for drinking water quality recommended by WHO. Options are: color should be less than 15 TCU, nitrates less than 20 mg per liter, turbidity less than 20 NTU, or it's arsenic less than 0.2 mg per liter. So yeah, you have to remember all the normal values like arsenic and all that. There are some normal values are there, which I also don't know right now. But yeah. So which of the following is true? So yeah, which of the following is true is the first one only, that is color of the permissible color in drinking water should be less than 15 TCU. That is a true color unit. TCU is a true color units. And yeah, it's all the normal values you have to remember. I'll just tell you again. See, for turbidity it should be less than 1 NTU. For arsenic it is less than 0.01 mg per liter. But they had given it's 0.2. No, it's a 0.01. Then only can tell it's a drinking water. And we have nitrates which is up to 3 mg per liter. So you have to remember like that. So color less than 15 TCU, nitrates less than 3, arsenic less than 0.01. It's that's all. So moving on to the next question, we have which of the following can be prescribed as a first line drug for a patient with painful diabetic neuropathy. Options are carbamazepine, tramadol, duloxetine, or it's a venlafaxine. So yeah, if you can answer, which of the following can be prescribed as a first line drug for a patient with painful diabetic neuropathy? It's carbamazepine, tramadol, duloxetine, or venlafaxine. So yeah, anyone wants to answer? I will just repeat the question. The question was basically which of the following which of the following is drug of choice for a patient with painful diabetic neuropathy? Options were carbamazepine, tramadol, duloxetine, or it's a venlafaxine. So yeah, if you know the answer, it's good only. You have to remember this. It's a drug of choice. I will just tell it's duloxetine is a drug of choice in this case, and duloxetine is a drug of choice for a patient with a painful diabetic neuropathy. So yeah, so it's a SSNRI, that is a serotonin non-epinephrine reuptake inhibitor, and it's used in painful diabetic neuropathy. Next we move on. It's a case with that is a 8-year-old child was diagnosed to have a focal seizures, was initiated on oxcarbazepine, and which of the following should be incorrect regarding the agent used? So basically we are using a drug. The drug name is oxcarbazepine. Oxcarbazepine we are using, that too for a focal seizure in an 8-year-old child. So which of the following would be incorrect? And the options are: it's a keto analog of carbamazepine, it's an enzyme induction potency less when compared to carbamazepine, it's a metabolized by glucuronide conjugation, or it's hyponatremia, risk is less when compared to carbamazepine. So yeah, anyone wants to answer? I know it's okay, I'll just tell the answer. Okay, it's an 8-year-old. I will just repeat the question. The question was, it's an 8-year-old child diagnosed with focal seizures, and she was initiated on oxcarbazepine. And so which of the following incorrect? You have to tell which of the following is incorrect. And the options were: it's a keto analog of carbamazepine. I don't think so. No, but you have to tell the answer. So it's a keto analog of carbamazepine. It's an enzyme induction potency less when compared to carbamazepine, or it's a metabolism by glucuronide conjugation, or it's a hyponatremia, risk is less when compared to carbamazepine. So yeah, the answer is D. That is, there is a risk of hyponatremia with oxcarbazepine is higher when compared to carbamazepine. So yeah, it's a keto analog. It's a keto analog. The active form is metabolized by glucuronide conjugation. That is also right. And it does not cause auto-induction of metabolizing enzymes. It can induce CYP enzymes, but less potent. Basically, it's a less potent keto analog, and metabolized by glucuronide conjugation, but yeah, there is a hyponatremia risk is higher in case compared to carbamazepine. Next we have persistent complex behaviorment disorder is considered when the grief reaction persists for more than 2 months, 3 months, 6 months and 12 months. It's a normal question. Yeah, if you can just tell, it's a persistent complex bereavement disorder is considered when the grief reaction persists for more than 2 months, 3 months, 6 months or 12 months. So yeah, it's 1 year. So you have to remember, it's like according to a DSM-5, persistent complex bereavement disorder diagnosed only after at least 12 months has elapsed since the death of an individual, having a close relationship in case of a bereaved adult, and 6 months for a children. So if it's a children, we consider as a 6 months, and if it's an adult, it's 12 months. So yeah, it's a persistent complex bereavement disorder. Next we move on. It's a case. It's an incessantly crying 5-year-old girl is brought to the OPD by her father. So you observe that she needs support to walk and her trunk is not symmetrically aligned. There is a history of recurrent fracture in her limb. She also had blood-stained vaginal discharge from a few days. On examination, the girl appears as shown in the given image. So what is the probable diagnosis? It's a syndrome basically. I'll just repeat for the last time. It's an incessant crying 5-year-old girl brought to the OPD by her father. You observe that she needs support to walk and her trunk is not symmetrically aligned. There is a history of recurrent fractures in her limbs. She also had a blood-stained vaginal discharge from a few days. On examination, the girl's appears as shown in the image below. Basically, we are discussing about a syndrome here. So yeah. Okay, I will just repeat it once again. It's an incessantly crying 5-year-old girl and is brought to the OPD by her father. You observe that she needs support to walk and her trunk is not symmetrically aligned. So there is a history of recurrent fractures in her limbs, and she also has a blood-stained vaginal discharge from few days. So on examination, girls appears as below. So what is the most probable diagnosis? So it's a Prader-Willi syndrome, Refensen syndrome, McCune-Albright syndrome, or it's a polycystic fibrous dysplasia. So I know if you might be knowing, but yeah, it's, and there are bony lesions which they have given in the image. Yeah. So yeah, the answer is really C. That is a McCune-Albright syndrome is the right answer. So yeah, it's a McCune-Albright syndrome which is the right answer because it consists of a precocious puberty, bony lesions, and capillary spots which has been given in the image. So yeah, the question is okay over. Next we move on to the next question. Next question we have, it's which of the following condition is correctly matched with this layer of origin. So yeah, it's a few. I cannot just tell you the image they have given. They have told 1, 2, 3, 4 like that. So yeah. So as I see before that question, there was one question for this McCune-Albright syndrome. I will just tell what is McCune-Albright syndrome. It is basically there will be a precocious puberty, bony lesions, and capillary spots will be seen as shown in the picture, which is mainly for this is McCune-Albright syndrome. So next we move on. Which of the following statement is incorrect? The options are: the most common cancer worldwide is lung cancer, the most common malignant tumor of the lung are metastasis, the most common cause of cancer mortality worldwide is lung cancer, the last is the lung is the most common site of metastatic neoplasm. So it's a easy one if you know. It's which of the following is incorrect? The most common cancer worldwide, lung cancer. Yeah, it's the right one what I feel. Most common malignant tumor of the lung are metastasis, and the most common cause of, see, I was only wrong, is the breast cancer. Okay, the right answer, I am only wrong, and the right answer was the most common cancer worldwide is not lung cancer, it is basically, it's a breast cancer. See, but yeah, what I know, the most common worldwide lung, that is in men it is lung cancer, and whereas in women it is breast cancer. But I didn't know women are more than men, I think. Okay, it's most common cancer worldwide is breast cancer. However, lung cancer remains the leading overall cause of cancer mortality. So if you think of cancer mortality, is the lung cancer, and overall is the breast cancer. And other options were right. That is the most common malignant tumor of the lungs are metastasis. The most common cause of cancer mortality worldwide is lung, what I told already, and the lung is the most common site of metastatic neoplasms. So yeah. Next we have a patient. It's a ABG question. I know ABG. Whenever ABG question comes, It's difficult for me also. Okay, a patient with a chronic kidney disease came with complaints of vomiting and diarrhea. So his blood gas report shows a pH of 7.4, HCO3 23, and sodium is 145 and Cl is 100. So what is your probable diagnosis? So if you know the normal values of all this, then only you can just answer. I'll just repeat the question. It's a patient who comes to you with a CKD and complaints of vomiting and diarrhea. So his blood gas report is like pH is 7.4, HCO3 is 23, sodium is 145 and chlorine is 100. So what is your probable diagnosis? It's a no acid abnormality, respiratory acidosis, metabolic alkalosis, or it's a high anion gap, acidosis with metabolic alkalosis. So yeah, if you know, then only. See, normal pH is what? They have given 7.4. So yeah, pH is normal in this case. Then we had HCO3. HCO3 they have given 23. 23 is also in normal limits. Then we had sodium, that is sodium is 145. So basically you have to calculate the anion gap. So if you calculate the anion gap, for an anion gap you know the formula for that. So anion gap is like sodium minus chloride plus HCO3. So if you just put the values here, it's like 145 minus 100 plus 23, so it's like 22 milliequivalent per liter. So yeah, there is a high anion gap, because you know normal anion gap, you know there is a value it is a high anion gap which is indicates a metabolic acidosis. So yeah, so the answer is high anion gap, metabolic acidosis with metabolic alkalosis, because there is also one formula for delta gap which we calculate and it's coming to 11. So yeah, if delta gap is more than plus 6, it's presence of metabolic alkalosis also. So yeah, I know I will also read once. Okay, next we have a patient with HIV and is on cotrimoxazole prophylaxis. So he presents with 4 centimeter laceration requiring suturing under local anesthesia. So which of the following local anesthetic agents will not be preferred in him? It's a Prilocaine, Procaine, Lidocaine, or it's a bupivacaine. So I'll just repeat once. It's a patient with HIV and is on cotrimoxazole prophylaxis. He presents with 4 centimeter laceration and you do a suturing under local anesthesia. So which of the following local anesthetic agents will not be preferred? It's Prilocaine, Procaine, Lidocaine, or it's a bupivacaine. So anyone wants to answer? Anyone means what? Only okay, it's a Prilocaine, Procaine, Lidocaine, or it's a bupivacaine. So yeah, which is not preferred. Okay, I'll just tell the answer. It's B, that is Procaine is basically not preferred in this condition, because see, the patient is already on cotrimoxazole. So basically there is a interaction between cotrimoxazole and Procaine, thereby inhibiting the action of Procaine. So yeah, so the patient is on cotrimoxazole therapy, that is a sulfonamide, and the action of sulfonamide is inhibited by Procaine. Basically the sulfonamide action will be inhibited by Procaine, and so it will not be preferred in this condition. So yeah, so the action of sulfonamide will be inhibited by Procaine, so it is not preferred, and we can give Prilocaine, Lidocaine, bupivacaine we can give. Next we have a medicine resident refers a patient with uncontrolled diabetes. So which of the following findings on a fundus examination would suggest a severe non-proliferative diabetic retinopathy? I repeat, that is, it's a patient with an uncontrolled diabetes. Which of the following findings on a fundus examination would suggest a severe non-proliferative diabetic retinopathy? So options are: if we have a significant venous bleeding in any of the 4 quadrants, microaneurysm in any 2 quadrants, severe hemorrhages in all 4 quadrants, or in the macular star. So if it is, which of the following findings on a fundus examination would suggest? Yeah, it would suggest a severe condition. So it's a significant venous bleeding in any 4 quadrants, microaneurysm in any 2 quadrants, severe hemorrhage in all 4 quadrants, or it's a macular star. So yeah, if you can just tell. There is a classification. Yeah, there is a classification. That is very mild, moderate, severe, and very severe. So yeah, the answer, I will just tell the answer here. It's a C. That is severe hemorrhages in all 4 quadrants. So you will classify it as a severe, that to non-proliferative diabetic retinopathy. So yeah, basically there is a full classification. I cannot just read the classification here. But yeah, it is very mild, moderate, severe, and very severe. And in we were talking about severe here. So in severe we have 4-2-1 rule. So what is 4-2-1 rule? It is basically severe hemorrhage in all 4 quadrants. That is 4. 2 is like there is a significant venous bleeding in 2 or more quadrants. and one is moderate IRMA in one or more contexts. There is a 4-to-1 rule, that too for only severe non-proliferative diabetic retinopathy. Next we move on. It's a 40-year-old lady abruptly develops high-grade fever with myalgia and bone pain 18 hours after penicillin treatment for early latent syphilis. So which of the following statement is incorrect about her condition? See, I'll just repeat the question. It's basically it's a case of early latent syphilis, and you have given penicillin, and after 18 hours the patient comes to you with a high-grade fever with myalgia and bone pain. It's an adverse event basically. So which of the following statement is incorrect? Options are: it is triggered by lipoproteins, penicillin can be used in future, fever usually comes down within 8 hours, or it says she must be treated with steroids. So you just think it's a adverse effects of penicillin. I'll just repeat the questions, repeat the options. It is triggered by lipoprotein, penicillin can be used in the future, fever usually comes down within 8 hours, or she must be treated with steroids. So yeah, if you know the case, if you know the side effects of penicillin, then you can just answer this. So yeah, which of the following is incorrect? So yeah, the incorrect one is she must be treated with steroids. No, for a syphilis patient, that too, if you give a penicillin, there is no need to give steroids, because it will increase basically. Yeah, it will increase. So yeah, it is first option is right, that is it is triggered by lipoproteins. Penicillin can be used, but not now because it's an adverse effect which we are seeing here, and fever usually comes on within 8 hours. That is also right. So yeah, so what they have given is a febrile reaction occurring within 24 hours of penicillin therapy for syphilis is suggestive of a Jarvis-Hertzsmeyer reaction. So they have just given a name for it. The name is Jarvis-Hertzsmeyer reaction. What they have given, that is a fever within 24 hours. Penicillin can be used. It is not correct. No, I am just telling penicillin can be used. The question was which of the following is incorrect. So it was a D, that is she must be treated with steroids. But yeah, I was just telling which are the right answer related to this case. That is it can be triggered by lipoprotein, penicillin can be used in future, and fever usually comes down within 8 hours. So yeah, and corticosteroids are only indicated in pregnant women and patients with neurosyphilis in whom the reaction can be more serious and life-threatening. So yeah, penicillin can be given. It's a right answer, right, with the syphilis. So yeah, next one we have, it's 1 month old male infant is brought to the OPD with vomiting. So a USG abdomen was done and is shown below. So what is the probable diagnosis? It's a duodenal atresia, congenital hypertrophic pylori stenosis, gastric volvulus, or it's an annular pancreas. So I'll just tell the findings in the USG, otherwise maybe it's a cervix sign and a nipple sign. So yeah, it's easy. If you know what is cervix and nipple sign, you can just tell what your diagnosis is here. So I'll just repeat. It's an 1 month old male infant is brought to the OPD with vomiting. USG abdomen was done, and USG abdomen shows a cervix sign and a nipple sign. So, and the options are, it's a case of duodenal atresia, congenital hypertrophic pylori stenosis, gastric volvulus, it's an annular pancreas. So yeah, so yeah, it's basically it's a if you have a cervix sign and that to have a nipple sign, it's a case of a congenital hypertrophic pylori stenosis. So yeah, see, I was just seeing the question. In that question, what I was telling in the penicillin, basically it is not a contraindication for penicillin used in future. Symptoms may be controlled by antipyretics, but it is not a contraindication for the use in future. So yeah, moving on to the next question. How much is one equivalent of calcium? That is a molecular weight, it's 40. So how much is one equivalent of calcium? 20 gram, 30 gram, 40 gram, or it's 50 gram. So if you can just tell one equivalent of calcium is how much? One equivalent is 1 mole of an ionized substance divided by its valency. So valency of calcium, it's 2. So basically it's like ionized valency of calcium is 2, because we write Ca2+. So in that case, if the molecular is 40, then it will be one equivalent, it will be 20 by 40 by 2. So yeah, it's basically 20. Next we move on. The question is, it's an insole salivity index is associated with which of the following bones? Options are tibia, patella, fibula, femur. I repeat, install salivary index is associated with which of the following bones? It's tibia, patella, fibula or femur. So yeah. Okay, the answer here is it's B, that is patella is the right answer. Basically, install salivary index we have to remember. It's used for determination of the patellar height. So that is a ratio, that is the ratio of the patellar tendon length to the length of patella. So it's a ratio of patellar tendon length to the length of patella. So there will be a ratio that is, if it's between 0.2 to 1.2 is normal. If it's greater than 1.2 it's a high lying patella, or is less than 0.8 it's a low lying patella. So yeah. Let's move on to the last question. While performing routine otoscopy, a patient is found to have tympanic membrane retraction with pars tensa draping over the incudostapedial joint. What is the grade of retraction? It's a grade 1 shade, grade 2 shade, grade 1 toss, or it's a grade 2 toss. I repeat, while performing a routine otoscopy, a patient is found to have tympanic membrane retraction with the pars tensa draping over the incudostapedial joint. So what is the grade of retraction in this case? It's a grade 1 shade, grade 2 shade, grade 1 toss or grade 2 toss. So if you know the toss and shade classification, then only you can just tell. So yeah, if you want to answer, it's the last question. Yeah, draping of pars tensa over the incudostapedial joint is classified as, the answer only I'm telling. Okay, the answer is B, that is it's a grade 2. So see, you have to remember both. There is a shade classification for retraction of pars tensa, and there is one more classification, that is a toss classification, that too for retraction of pars flaccida. Yeah. So you have to remember. See, yeah, it's an interesting one. We are talking about pars tensa. So see, there are two classifications. One is for that is a pars tensa, other is for pars flaccida. So if it is toss classification, it's for pars flaccida. So two options are ruled out here only. So it's in only that we have a shade grade classification, which is for pars tensa, and that too it is grade 2, that is retraction drum touching the long process of incus, which they have given below. So okay, I'll just tell the grading ones for very fast. Grade 1 is like mild retraction not touching the long process of incus. Grade 2, there will be the retraction drum touching the long process of incus. Grade 3 will be touching promontory but mobile on sagittation, that is atelectasis of middle ear, and the last option is grade 4, that is a plaster to promontory and immobile, and that is adhesive middle ear. So yeah, it's adhesive middle ear, grade 4, atelectasis grade 3, touching is grade 2, not touching is grade 1. So yeah, we have completed the MCQs. So yeah, thank you so much, and yeah, I think okay, thank you.